Det här var ju tänkt som ett pass för IAPO att ta. Vi hade ju vår inledningstalare idag från IAPO och tanken var att vi skulle fått en presentation av någon därifrån. Men de överlät det till mig och det var ju roligt för mig. Men vi hoppas att det här går bra då. Och I will take it in English, of course, as promised. So I just try to explain that if you didn't see Penilla Gunther in the program for speaking, we should have another person from IAPO, our introduction speaker today. But since Neda couldn't come, they wanted me to present this report about Personalized Cancer Care Alliance and this position paper. So I think we could just see if I can take this. Yeah. The position paper, which this seminar is going from, is really something that we from FOKUS patient side really would like to say that we need to really learn from each other. It's no point really to invent the wheel all over again, because we do it all the time, actually. And when I saw this paper from IAPO, and it said that it was personalized cancer care, I could immediately see when I looked into the report, and you can find it at their website, that you can translate this to any kind of diagnosis area. I have one example of this report here. Because personalized care, this is the whole day is about that. But how can we learn to translate it, from different cultures, maybe religions, maybe different ways of seeing your healthcare systems? There are many point of views you can have on how you see also, or how it should be personalized care in your environment or in your country. And this one has taken a step from the Eastern Mediterranean region, and you can say that, well, that's quite far from Sweden. Can we really learn something from that area? But if you just look around, you look around in streets, in subway, in buses, all over society, what do you see? A lot of people coming from all over the world to Sweden, and maybe, I just say maybe, we should learn something also how they see the healthcare system in their countries when they come here. It makes us understand better how to treat people also with that kind of knowledge taking in account, I guess. I hope. I will see what the small panel will say after this. But this position paper, it also sets the baseline, for further discussions, and that's really what I would like to see here today. Personalized, cancer care in this case, it's really something that I can refer also to Mario's previous speech here, that personalized is the total opposite of one size fits all. Can we agree? and that's really, to really see the human, the person in front of you. And if we like to really develop some kind of care that really fits the person, or help us all to understand also what it's all about, I think we all need to see that everyone likes to be seen as a person, as one person, and also to relate to the previous speeches today about, the whole person. Also, when you see that one body part might have a connection with another, really, and when you have a diagnosis within your heart, it can also affect something else in your skeleton or in your head or wherever it is. This framework approach, there are a lot of I think we will listen to 4 P's tomorrow, and today there are 5 P's. So, but an approach, I guess, to this person-centered care or personalized care is really to be predictive, preventative, participatory, personalized, and preemptive. And isn't it also what we like to see in a process within healthcare? We like to know what will happen. Otherwise, it's quite crazy to have someone telling you, you have the doctor in front of you telling you that you have a diagnosis that will be treated like this and this and this, but you have no idea, where or when or with what. That seems nowadays like crazy, because people like to know what will happen. And I would say also, to add to this, that the well-informed patient today, I really would like to think that we have more well-informed patients. They are expecting so much more, really, than to just have an empty message. You have a diagnosis and you will have a treatment. Okay, thank you, goodbye. It's not that way. So you really need to see what will happen. It has to be predictive, and also, of course, everything else that is mentioned in these 5 P's. But I think the benefits that are in this report that are mentioned is also that when we apply these 5 P's, you can also see a result in health economics. You can see it in the health system. You can see it also for the patients, because you don't have to see people who maybe have unnecessary treatments, if that's the case. And they can also, the hospitals and the healthcare system might have also a chance to really keep up with healthcare workers as well as the financial systems. To talk about personalized treatment, it's for me not only a form of treatment that is the expression of personalized medicine. It's really a personalized treatment that is person-centered. And what we are discussing today is really all the expressions also mentioned that is very confusing sometimes. Is it patient-centered? Is it person-centered? We have heard about precision health today, precision medicine. We have a lot of expressions today that is not so easy for patients, or I guess within healthcare. We have representatives now in the panel from both doctors and nurses, and the most crucial healthcare workers. And I guess it's sometimes confusing for you as well to have all these expressions. And if you also have these well-informed patients, how can the communication really work between patients and healthcare workers? These recommendations from this paper is of course very, very depending on what kind of country you have and the possibilities and how far the healthcare system has reached. But I guess that you can see that some things are the same for everybody, everywhere. And to really see the person is something that won't cost more. It really can only be a benefit to have a personalized care. I hope, well, at least not someone will disagree with me with that, because if you have a system that do not see the patient, can you really see a benefit in that kind of healthcare system? Who are you working for? So, and I should not taking any more time to talk about this report or something like that, but just has it as a background for our conversation. And I would like Roosi and Sineva to come and stand with me on the stage and just have some opinions now. So,
hi. Thank you.
Welcome.
Thank you. Thanks.
Do you agree that there are some improvements to do within person-centered care? Or is it really, can you call it a person-centered care in Sweden? And especially for people coming from other countries?
You're asking if we are there.
Yeah.
No, we are not there in the Swedish healthcare either. I think the position paper is about the structural level, how to integrate and make a diagnosis with cancer patients together, individually. And as a health professional, as we are, I think that the precision medicine and the precision health, together with the person-centered care, it's 1 + 1 get 3. So I think you get more out of it if you have the person in the room seeing the human being. So I think we have a lot to learn still in Sweden.
Yeah. I agree. I think we need to put the puzzle pieces together, and we can only do that by working together. And that's also why I think it's so important that we have a very good team to do that. And there are many, many parts, I think, that should be interconnected. In Swedish, we have an expression which is separata stuprör, that we
separate pipes.
Pipes, exactly. Who are collecting the rainwater. We need to unite them so that we all come out at the same place. I think it's very important that we see it as honeycomb also, that there is a lot of actions, because one thing is, for example, to affect the legislation, but we also need to make sure that the legislation is also followed. Patients need access to their patient data, yes, but who takes care of the patient in a patient safety perspective, that the patient can actually understand his or her data, and who helps the patient and who protects the patient so that the patient is not walking away with his or her data and meets someone who takes advantage of that. Who takes care of the patient and who protects the patient? I think it's very important to think about many pieces.
You think about health literacy also. I mean, because we have a seminar tomorrow. Did you? I think the headline is. Did you hear what the doctor said?
Yeah.
or
Most
understand?
Of the time, no.
Yeah, because it's often that way. I guess that that people also from another background or with another background really says that yes, I understand, but the healthcare professional can see that maybe the message has not gone totally through the mind, and also need to have maybe some written information also. I mean, to protect the patient is really to make the patient to understand what is happening.
I think the person-centered care is really about when we walk out of the room with the healthcare professional, we have a plan for my health. And I understand it, and I know what I have to do to go home and do it so the health is better. We should do our examinations and we will do our care, but the patient have to do his care or her care. And I think the health plan is one way of checking out, did you really understand what we are going to do with you and your health together? I think that's the strongest thing of the person-centered care. With the personalized, you get more than before.
Do you really increase or improve the use of the treatments you have?
Yeah, really.
Yeah.
And you can check it out.
Yeah.
And you know what you have to do as a patient to get a better health. I think my parents are from Portugal, and she would never say no to the physician, never. Yes, I do understand.
Yeah.
Did you really, Mom? No. But you know it, Sineva. Yeah, I know it, but I think it's important that you know it. So we have a lot of debts that we have to go through to understand the individual. Yeah, really. And we can learn. We do that all the time in the healthcare. And I think we can learn from each other. We don't do that even in Sweden. We do it at 21 different ways in 21 different regions. And I think that we have to learn much more because we have to be most cost effective. And we don't have the healthcare professionals that we need if we want to do it in 21 ways.
You said your mother or your parents are from Portugal, and I know, Roosi, you also have another background. You're from Estonia.
Yes, I'm half Swedish, half Estonian, and I can talk about the Estonian healthcare system and compare that. I've also been working in Finland, so I can also compare to that. And I was just talking to a colleague from Belgium, hello, and at lunch, and we talked about that the primary care system is so different in different countries. In Sweden, for example, because I really believe that primary care is very, very essential and must be in the center. In another way, the Swedish organization, a structural organization of healthcare, needs to change to be able to deliver a person centered care in a correct way. Because in Sweden, sometimes when you go to a family physician, quite often you meet a different family physician each time. If you, in Estonia and in Belgium, you get your family physician when you are 2 months old, and you continue to visit that person. That person knows you very well, knows you have a dog, knows your neighbor, knows so much about you, which enables different kinds of, for example, digital solutions to work very well too. If I know you for a very long time, it's easier for me as a doctor to take care of you.
It's easier to have a personalized care because you know more about the person.
Yes, yeah. And the communication. If we speak about that, because the communication is always in the center.
Sineva?
I think in the best of worlds, we should have the same physician and the same nurse from 2 months and all the time. But I don't think we are in that position today. So how can we use the patient knowledge about their healthcare to get away of that obstacle that is that I don't need the same healthcare every time I go to the healthcare. But can we have a structure that help us? I do really think that we have to make a transition to a more good primary healthcare in Sweden. It have to be the first appointment as a patient, a person. And it is not like that really today. So we have a lot to do about that. But even that, I think we still treat one disease at a time. So if I'm working at the primary healthcare, I've done that, and I meet a patient and I said, you are here for your blood pressure. Yeah, I'm going to, but I have an ache. No, that you have to make another appointment for that. So we don't see the whole person, I think, and we have to have structure for that to get a better cost-effective healthcare, but even a more person-centered healthcare, because you don't go to the healthcare if you don't need it. We think that persons want to be in the healthcare. No, they don't want to be in the healthcare.
I guess they rather go to a mall or go out in the forest or something like that.
So I think we have to see the patient in a whole when he really is meeting us. So I think you have right about we have to make the transition, but we aren't there yet. We have talked about it over 10 years, but how do we do it? It's an organized structure that's bigger than me and you.
It's bigger, yes, but I think I'm optimistic.
Take steps. Yeah.
Yes, baby steps.
Yeah,
and
steps.
I really, there are so many representatives in this room also from pharma, for example. Pharma is a very, very good partner, I would say, because who can drive innovation? Who can help with legislation?
Patients organizations.
The patient organizations. I wanted to save the best for last. That's. I wanted to say this. I would like to see that more information goes to the patient from patient organizations, also about legislation and legislation about primary care, because I am quite sure that there are very many patients who are not aware of which laws actually apply in Sweden. Patientlagen, the patient's law, to raise awareness and to interfere. That is usually what leads to action and change. So how do we do this? We are all working with raising awareness, but we also need to interfere, because it doesn't help if we just spread information. We need to implement it as well.
And that's also I think everybody is talking about the difficulties with implementation. I've been involved with seminars for several years about, making pathways for innovative medicines and so on, and fast tracks and other expressions. And I think the most difficult thing is not to really come to a decision sometimes. Yes, it can take a long time, that too, but even though if it's decided to have an implementation, it will take more time to do that. And I would just like quickly go back to this report and put it in a Nordic or Swedish environment. We have had a lot of people coming from the Middle East or other countries. The refugee wave, as we have called it in 2015, we have had other waves, and maybe we will have several others coming. And to really understand what kind of environment of healthcare these people are coming from, and coming to Sweden, where we have another system with nurses who are very high level. I heard, and also in an international perspective.
We are.
Yeah, more responsibilities and so on, and to doctors within primary care who are also very general and knowledgeable. And how do we think that people coming from totally different environments within healthcare, where the doctor is the boss, really, and to meet a nurse instead? Sineva.
I have worked in an emergency care unit, and I went in with a physician who was a woman, and we take the good care of the patient. And then I got back to do something, and she said, "When are the other doctor coming?" Oh, she was really here. I think I think really that I think the person, if we work from a person-centered care, it doesn't matter who you meet in the healthcare, you get the healthcare that you need. And if you have a goal to meet just one of the health professionals, we have to really show that the other ones can do it even sometimes better, I think. So I think even the physiotherapist can be one of the team that we work as a team in Sweden. I think the problem today is that we think that we work person-centered, but we don't. And it's a hard work to do, and we don't have an organization who support us on that. We have to do it ourselves as professionals and create the teams. We haven't really implemented it at the big level time. We have some projects around the Sweden that are very good, but they are because we as professionals are driving it. So I think, we have to learn from those patients. We have to have another time of questions. I think we have to have someone in the room who talks their languages. We had a politician discussion of not having that, and I think that's wrong. As a child, I will never would interpret for my parents or my mother or my father. I think that's important. We have to have a meeting that connects. So I think that's most important thing. We can't say we have to learn them how the Swedish healthcare works. It doesn't function that way. They will seek healthcare when they are needed. And in that meeting, we have to appoint, you are going to meet, if it is a physiotherapist, you're going to meet a physiotherapist. They are going to help you on this and this and this. And that's the plan. So I think the person-centered care can help us on that, really.
To use really the method. Of a person-centered care. Roosi, you're from Örebro.
Yes.
That's a city in Sweden where we also have a lot of people coming from different countries, and I guess you have met some from Africa or from Middle East or some other areas in the world coming to Sweden and to Örebro. Can you see a difference? You know what they have. I mean, what kind of experiences do they have that you can see that maybe we can learn also from them? And as Sineva said, we shouldn't teach people, but we can learn them maybe some things also about primary care or where to seek their health care or something like that.
Well, yes, Sweden is diverse. I think I recognize what you said, Sineva, about some maybe differences, male or female doctors, but I think still, at least my experience is that most patients will listen if they see that you are interested in helping them. And it's not difficult, because if you just show up to the patient, meet the patient where he or she is in their disease journey, you reach where you want. And it's very important to involve the patient, because if you just talk over the head, then that will not lead to what the result you want to have, because it's important to have a long-lasting, sustainable change, usually in behavior, for example, if you're treating a burnout. And you need to have the patient, you need to walk by the patient in the journey the patient is on. And that means that you are stopping when the patient is stopping. But I don't really see the it doesn't matter where the patient comes from, but of course you can take that into account and have an understanding of, for example, why does this patient react to pain in this way, or that one in that way. But I think maybe it's more important where we are going than where we are coming from. So I would suggest to really try to put the puzzle together. But it comes as no surprise that person-centered care needs to be with the patient, of course, in center. But what is very important for this care to be in accordance to patient safety is that the settings from the hospital or primary care settings are allowing the healthcare professionals to deliver. And that is actually today a problem that we are experiencing, because there is a lack of people, there is maybe not optimal education of HCPs, there is maybe scheduling problems and so on. So there is not one answer to this question. This is really...
it's a combination of different areas.
Yes, yeah. And it must be, because we are trying to target an ecosystem, and there is not just one problem, but we need to work on many levels. Yeah.
To make people feel that they are taken care of and really have their say. I mean, person-centered care, the definition of it is also to involve the people around, you know, as we say, the family or other people around that might matters to the patient. And in some environments, we can see that the family are really everything. Is really everything for the patient. And in Sweden, we used to say that it's the country in the world who has the most lonely citizens, and have another point of view maybe of what the family matters or everything around that. Can you see that also, that, you know, when you have people also to discuss with around the patient, that it's really something that is a benefit for both you as healthcare professionals and also for the patient? What do you say, Sineva?
I would say yes, but I have a daughter who's born with half a heart, and now when she got 15, at 15 years old, the physician said, and the healthcare professional said, that we will talk to Sandra before we talk to you. And that is an important thing, I think, because as a relative, it's important, but I can also take over, and I don't want that. So as a healthcare professional, I usually say, I will talk to the patient, and then you'll come in and we talk together, all of us, because I think that's an important thing to do. But yes, I think so. I think we have some conflicts in Sweden with person-centered care against patient-centered care, and I think put that aside. It doesn't matter, because you are always a person, even if you are a patient. And as a patient, you have the rights. And I think the legislation and the laws in Sweden say patient, so we have to do something about that. But I think the important thing is that you are a person who are a patient right now and who want to get help from healthcare. And those three things get us in the meeting, the help that you need as a person. So I think, and as a physician and as a nurse, I can do what I'm good at and still help you on that issue. But yes, I think the persons around the patients are very important too. Yeah, they are.
I guess they can help a lot. I mean, we sometimes talk about drug adherence. I mean, to really help a person maybe to take the right medicines in the right time. I mean, you need some people around you sometimes to really remind you about the importance.
Absolutely. But there are also situations where the patient doesn't always get the right advice from people nearby. I have worked quite a lot with women suffering from domestic violence, and they've definitely not always gotten good advice from people around them.
No.
That's not, so everything is contextual.
Yeah, and that's what I mean about, the environment, really. And if we take into account that the family members or other friends or other people surrounded the patient really also know the right information, it can really be a help for both healthcare and for the patient, I guess.
And you can put it on the personal health plan together.
Yeah.
I think that's the most important thing. If you as a patient really, as a person really want that, then we put it on the plan together. And then we have the partnership where the relative is one of the partner. I think we have the narrative, how that person lives at home and what's the need is to really get the plan doing and go forward. And you have the documentation. So I think you can do both, really.
Yeah, and if we should just finish with these 5 P's also from the report. Predictive to improve patient health outcomes, patient experience, and match patient preferences, as it says. It's really, to come back to what you said, Sineva, to have a personal health plan and to work according to that.
Yes, yeah.
And of course, as a patient, then you should be involved in that all the time. Or if it's not possible for you, at least someone else
can do
around.
it.
Yeah, it should be that way, I guess. But also predictive in that way, as I mentioned before, that if you have a healthcare process, you should also be aware of what will happen.
Yes.
Do you feel as healthcare professionals yourself that people, if we talk about health literacy or information and how you accept it, do you feel that patients do they understand it? Can they
Today we meet patients who are very well, they have a good knowledge about their diseases when they come to us. And many of them already say, you have to do this and this and this, because I know I have this. Sometimes they are wrong, and I think that's important. That's our job to see, or our knowledge to use. But I think, I think we are not so good of telling, you are going to, in Sweden, you are going to have this and this and this. Yes, we are good at that. But the time it will take, we never know. Because you have to wait a lot in the healthcare today because of the decrease of health professionals, I think. So we don't know when you are going to do all that. But that we are doing it, I think it's important that the patient knows. And I think we have to work much more before you get sick. Yeah. In the world, they talk about people-centered care in an environment, in a city or something like that. I think we have to work a lot more on that in the primary healthcare.
The prevention.
Yeah, the prevention care is
and maybe preventive information also.
Patient organizations.
Yes.
But really, as the primary care system is looking in Sweden today, we need help, really. And I think that really patient organizations are so important for helping the patient. But I believe that actually pharma also has a place in this, and that can lead to faster change, because HCPs there is a lack of HCPs, but that depends on that there is a structural, organizational issue that needs to be addressed. So I don't really believe that we can change the system. I mean, we can always exchange doctors or nurses or midwives or all helping, but that will not actually solve the problem. We still need more doctors per patient, more nurses per patient, or as in other countries where you have your family nurse and the doctor.
It's an organizational structure revolution then.
It would be needed to be addressed, or at least also on that level, if we would be able to somehow change the situation for a more sustainable care for the patient.
I think we have to do a lot of things. I don't think we have one thing and we'll solve it. So I think we have to do that, and we have to see what's in 5 or 10 years, what the knowledge the health professionals have to have. It's not the same as we have today. It's different. And how can we do that already? We can't wait 5 or 10 years and then say, oh, we have the wrong knowledge. No, we have to do it right now. How is the healthcare on the people? How can we change that and work before they get really sick? Because it doesn't cost as much as they are needed of the healthcare in the hospital. So we have a lot of things to do. And my way is we have to start doing it now, not wait, really. And we can learn.
Presence and future is always with us, I've heard. Thank you so much for the discussion. And now we're approaching something that we're doing every year. But I think a hand for our panel.